Welcome to NCLEX Success Tutorial. On the types of shocks in pediatric nursing, shock in pediatric patients is a critical condition characterized by inadequate tissue perfusion and oxygen delivery, leading to cellular dysfunction and organ failure. 1. Hypovolemic shock. Hypovolemic shock occurs due to a significant loss of intravascular volume, leading to decreased preload and cardiac output. Signs and symptoms: tachycardia, weak peripheral pulses, and hypotension. Cool, pale, and clammy skin, delayed capillary refill time. Decreased urine output, altered mental status, and thirst. Medical management: fluid resuscitation with isotonic crystalloid solutions, e.g., normal saline or lactated Ringer's solution, to restore intravascular volume. Blood transfusions for severe hemorrhage or anemia. Inotropic support may be necessary in refractory cases. Nursing management: monitor vital signs, fluid balance, urine output, and mental status. Administer fluids as ordered, closely assessing for signs of fluid overload. Provide emotional support to the child and family during resuscitation efforts. The second type of shock is distributive shock. Under distributive shock, we have septic and anaphylactic shocks. Let's start with septic shock. Septic shock results from systemic inflammatory response syndrome, SIRS, due to severe infection, leading to vasodilation, increased vascular permeability, and maldistribution of blood flow. Signs and symptoms: fever or hypothermia, tachycardia, and bounding pulses. Warm, flushed skin with delayed capillary refill time. Altered mental status, hypotension, and signs of organ dysfunction. Medical management: prompt administration of broad-spectrum antibiotics. Fluid resuscitation with isotonic crystalloid solutions and vasopressors, e.g. norepinephrine, for refractory hypotension. Supportive care for organ dysfunction, e.g. mechanical ventilation, renal replacement therapy. Nursing management: monitor for signs of sepsis, including frequent assessments of vital signs and organ function. Collaborate with the healthcare team to implement sepsis protocols and monitor response to treatment. Educate caregivers about infection prevention and recognition of early warning signs. Anaphylactic shock is the next under distributive shock. Anaphylactic shock occurs due to a severe allergic reaction, leading to widespread release of histamine and other mediators, causing vasodilation, bronchoconstriction, and increased capillary permeability. Signs and symptoms: respiratory distress with wheezing, stridor, or difficulty breathing. Urticaria, hives, angioedema, and pruritus. Hypotension, tachycardia, and gastrointestinal symptoms, e.g. nausea, vomiting, abdominal pain. Medical management: prompt administration of epinephrine as the first-line treatment. Airway management and oxygen therapy for respiratory support. Fluid resuscitation and vasopressors for refractory hypotension. Nursing management: assess and manage the airway, breathing, and circulation ABCs as a priority. Administer medications as ordered, monitor response, and watch for adverse reactions. Educate patients and families about allergen avoidance and emergency action plans. 3. Cardiogenic shock. This is the third type of shock under review today. Cardiogenic shock results from impaired cardiac function, leading to inadequate tissue perfusion despite normal or increased intravascular volume. Signs and symptoms: tachycardia, weak peripheral pulses, and signs of heart failure, e.g. hepatomegaly, pulmonary edema. Cool extremities, cyanosis, and hypotension. Decreased urine output, altered mental status, and poor perfusion to vital organs. Medical management: inotropic support, example, dopamine, dobutamine, to improve myocardial contractility. Diuretics for fluid overload and afterload reduction medications, e.g. nitroprusside, if indicated. Mechanical circulatory support, example, extracorporeal membrane oxygenation, ECMO, in severe cases. Nursing management: monitor cardiac function, hemodynamics, and signs of worsening heart failure. Administer medications as ordered, titrating doses based on patient response. Collaborate with the healthcare team to optimize cardiac output and tissue perfusion. Obstructive shock. Obstructive shock is the last type in this discussion. Description: obstructive shock occurs due to mechanical obstruction of blood flow, impairing cardiac output and tissue perfusion. Signs and symptoms: hypotension, weak pulses, and signs of cardiac tamponade, e.g. Beck's triad, hypotension, muffled heart sounds, distended neck veins. Cyanosis, respiratory distress, and signs of pulmonary embolism or tension pneumothorax. Medical management: emergent interventions to relieve the obstruction, Example, pericardiocentesis for cardiac tamponade, thrombolytic therapy for pulmonary embolism. Surgical interventions for conditions like aortic dissection or congenital heart defects causing obstruction. Fluid resuscitation and inotropic support as needed. Nursing management. Monitor for signs of obstructive shock, especially in patients with known risk factors. Assist with emergent procedures and provide support during resuscitation efforts. Educate patients and families about preventive measures and signs of complications. Effective management of the 4 types of shock in pediatric nursing involves a comprehensive approach that includes rapid assessment, appropriate interventions, continuous monitoring, and collaboration with the healthcare team. Here are the key strategies for managing each type of shock. Hypovolemic shock. Interventions. Initiate rapid fluid resuscitation with isotonic crystalloid solutions. Example, normal saline or lactated Ringer's solution based on the child's weight and degree of hypovolemia. Distributive shock. A. Septic shock is the first type under distributive shock. Interventions. Administer broad-spectrum antibiotics promptly after obtaining appropriate cultures. Initiate fluid resuscitation with isotonic crystalloid solutions, titrating to maintain adequate perfusion and hemodynamic stability. Consider vasopressor therapy, example, norepinephrine, for refractory hypotension. Anaphylactic shock falls under distributive shock. Assessment. Obtain a thorough history of allergens and previous allergic reactions. Interventions. Administer epinephrine promptly as the first-line treatment for anaphylaxis, following established dosing guidelines based on the child's weight. Provide airway management and oxygen therapy as needed for respiratory support. Initiate fluid resuscitation with isotonic crystalloid solutions for hypotension. Cardiogenic shock. Interventions. Initiate inotropic support, e.g. dopamine, dobutamine, to improve myocardial contractility and cardiac output. Administer diuretics for fluid overload and afterload reduction medications, e.g. nitroprusside, as indicated. Consider mechanical circulatory support, e.g. ECMO, for refractory cardiogenic shock. Obstructive shock. Interventions. Perform emergent interventions to relieve the obstruction, such as pericardiocentesis for cardiac tamponade or needle decompression for tension pneumothorax. Administer thrombolytics for pulmonary embolism or arrange for surgical interventions for aortic dissection or congenital heart defects causing obstruction.